Good evening, and thank you for joining us tonight. The Frontline Health Worker Digital Theater Project is presented by Elevate Theater Company, LLC, and the University of Pennsylvania's School of Nursing. My name is Christina D. Eskridge, and I'm the founder and executive director of Elevate. I join you tonight from the land of the Muncie Lenape and the Wappinger people. The University of Pennsylvania rests on the unceded lands of the Lenni Lenape. We acknowledge that the lands, waters, and airs we reside on was and still is stewarded by these incredible Indigenous communities, past, present, and future. For those of you new to an Elevate event, we pride ourselves on providing free theatrical programming that supports the exploration of health and well-being, and tonight we have a treat. Our program features 2 plays depicting frontline health worker experiences during the COVID-19 pandemic. As always, we will follow these performances with a panel of experts, including Penn Nursing and Penn Medicine, as well as our playwrights. We will discuss health worker burnout, vaccine hesitancy, and how the arts can heal, among other things. So don't be shy. Feel free to put your questions in the chat and have discussion throughout tonight's program. Our first play, A Soft Landing by Ange Bay, is set on the moon. This piece is an intimate, grounded look at relationships and the public health issue plaguing our nation. We will have a 5-minute intermission before our second piece, Silos, by Nikki, Brake-Sillá. This play transpires over 1 day at a hospital 2 years into the global pandemic. Over the course of this day, we'll see firsthand how shared trauma has strengthened the bonds between people and see how they rely on each other for support, strength, and hope. I'd like to say 3 really huge thank yous off the bat. First is to the Sachs Program for Arts Innovation at the University of Pennsylvania for their generous support of this evening's event. Thank you for helping us make art an integral part in how we look at health. Second, I'd like to thank our incredible partner, Penn Nursing, and especially Marian Larry, whom I have been working with for almost a year now, and you'll be hearing from her a little bit later. We've been cooking this up, and we are so excited that we have come to tonight. Last, but certainly not least, I'd like to thank the frontline health workers. Several members of Penn Nursing and Penn Medicine have supported the creation of both of these plays, and we are forever in debt for your honesty, compassion, and selfless care of others. Tonight, we dedicate this event to you, all frontline health workers. Now, I'm going to turn it over to our partners at Penn Nursing and introduce Dr. Antonia Villarreal, Professor and Dean of Nursing at the University of Pennsylvania's School of Nursing. Dr. Villarreal?
Thank you for that introduction, and thank you to all of you for joining us this evening. The pandemic has affected all frontline healthcare workers, whether you are a nurse like myself and Marian, whether you're a physician, a pharmacist, transport, or you work in environmental services. You
Dr.
have been
Villarreal,
impacted in ways.
I'm so sorry to interrupt you, but we can't see you right now, and I would love to see your face as you're giving this address.
I don't know, I'm having technical difficulties.
No problem. We can continue, but just wanted you to be aware and let our audience know that we are live and live theater is amazing, and we will continue to troubleshoot. Thank you. Please continue.
Difficulties, but that doesn't detract at all, again, from this wonderful event. I want to share with you that storytelling has been instrumental, and not just in relaying to the public what we have been through and continue to go through, but also as a form of therapy. Sometimes we need to be reminded that we're not alone. Sometimes we need to process our feelings by talking about them. And sometimes we simply need to share a memory or trauma or the story of strength we found in ourselves, both healing for ourselves and for others. And tonight, Elevate Theater Company has partnered with Penn Nursing for a virtual theatrical performance based on the experiences of those who work in healthcare. It may be cathartic for some who have experienced this pandemic on the front lines, and eye-opening for those of you who have not. The plays will explore the themes of burnout, vaccine hesitancy, and more, discussed during our panel with Penn Nursing and Medicine experts following the performances. Again, I want to thank and congratulate Marianne Leary, Penn Nursing's Director of Innovation, for leading the charge to bring tonight's program to fruition. She and Dr. Terry Richmond, our Associate Dean for Research and Innovation, have been instrumental for helping center innovation in everything our school does, and this includes in the way that we communicate. It's critical that we amplify nurses as leaders in health and healthcare, whether we are communicating with our patients, our colleagues, or the community at large. And we know that our voices are important when it comes to spreading needed health communication information to the public, as we will hear this evening. We have a particularly important role in standing against misinformation about COVID-19 and about misinformation in the broader context. Thank you as well to the Elevate Theater Company and to the actors, directors, and playwrights involved in tonight's performances. Thank you to the nurses and the other frontline workers who have shared their truths, both for these performances and everywhere healthcare workers are being heard. Thank you to our panel discussion with experts from Penn Nursing and Penn Medicine, Hope Adkins-Durante, Horace Hubbard, and Zachary Meisel. And of course, thank you again to the SACS program for our innovation for making this event possible through crucial grant funding. The University of Pennsylvania's community is richer for your work and your support and vision, and for our students, faculty, and centers. I'm grateful to all of you who are joining tonight. And now, without further ado, please welcome to the Elevate virtual stage, A Soft Landing by Ange Bay.
In hospitals, a lullaby is played each time a baby is born. I didn't know until my own daughter was born on New Year's Day. She was 5 weeks early. I'd been sort of aimlessly walking through life without a plan, no prospects, no real future to build or invest in, because why would you? When you're too angry, depressed, and disheartened by everything. I mean, how many seconds are we till midnight? I've lost count. After experiencing the man-made cruelty of this planet, would you make any real choices too? I checked out. I let things happen as they pleased, falling in love, moving here, getting pregnant. But we couldn't keep the baby, no. It felt irresponsible and short-sighted, selfish, hypocritical. I mean, look at our world. Look at our world. Look at our world. But we made our choice, for better or worse. And this is going to sound crazy and maybe a little irresponsible or insensitive, but I was proven wrong about all of it. It took the NICU. The existential crisis that I had about the world and its people was absolutely debunked in the NICU. There I found a utopia. Sure, the situation was dire, but my partner and I were surrounded by strangers eager to save the life of a person that they had never even met. Imagine that. One of the nurses, Kendall, she literally held my hand through all of it. I had never felt so much compassion from strangers. Then and now it felt like
a dream. And I just hope our daughter will grow up to experience that kind of love sooner rather than later. I hope every child does. I wish every child did. And I found myself grieving the childhoods of anyone who's inflicted cruelty. I found myself grieving my own childhood. I feel a lot, and I know it's common in our profession, so I'm just happy to be seen. And then Samaya was born, and she was staring back at us with these big, brown, expectant eyes. She was real. Oh, and she dared me to take what I had learned in the NICU and apply it to our new life. And then there was the lullaby. How could I make the dream real? I decided to become a nurse. I want to save the world or discover a new one. Whichever's the first expedition. I believe it starts here, in hospitals. They're stations between life and death where people are most vulnerable in front of strangers. I believe the healing that's done here is beyond physical. I believe that whether they like it or not, people leave this station changed. I no longer think it's too late to save each other. And I'm dedicating my life to this mission. And I'd like to start right here, right now, if you'll have me.
Code blue, 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 code blue.
Are you getting tired? Epi's in. This is the 5th dose since vasopressin.
Stop CPR for a minute. Are they assisting at all?
No respiratory effort.
Pulse?
No pulse detected.
Does anyone else have any other suggestions? Let's stop. Time of death, 8:43 p.m. Okay, everybody, I know we're really busy, but can we just take a moment for a pause? This was somebody's parent, somebody's spouse, somebody's friend. Know me, care for me, ease my way. It's our mission. Let's take the time to honor the fact of this person being here with us, and also how hard we try to save them. Has the family arrived?
Nurse! Hello, nurse! Hello? Is anyone there? I need assistance pronto! Hello?
Sir? It's not a speaker.
What? Well, you heard me, didn't you?
Buzzing? Yes.
You have terrible customer service.
What did you need, sir?
Oh, I'm ready for my call.
Okay. All right. In about 2 minutes, you'll receive an incoming call. You'll see a little icon pop up. Just touch it, and then everything will be good. Okay? Anything else?
Oh, can I get a refill of water, please? Thank you. Oh, wait. Sorry. I'm a simpleton with this eye-tech stuff. You mind staying?
Thing?
You know, just in case the signal goes out. You're young. You can figure this out more than I can. I really appreciate it. I know you're busy, but I really appreciate the help. You know, if I could, I would pull it over for you. Is it heavy? You can sit closer, you know, just in case.
I've got long legs and fast hands. Oh, your heart rate is climbing. Are you nervous or should I be worried?
Is that a trick question? Oh, man. Hey, can you see me? Can you hear me?
Yes. Yes.
I probably look a wreck.
No.
It's good to see your face. It's been too long.
A call works both ways.
Well, this isn't just a call. This is FaceTime or Zoom or one of those. I'm on an iPad. It's pretty cool. It's big and expensive. Eek.
No one's there to help you?
No, not at all. I'm all alone. You know me.
Well, I won't keep you for long. It's late.
Well, listen, you can. I've been looking for this all day. And I just want to say thank you. It really means a lot. And, you know,
Are you dying?
no,
Is there a doctor I can speak to?
no. Anyway, nurses are the real ones running this show. I know it looks all scary and whatnot with all these machines around me, but I'm only here to get my oxygen up. I don't even have COVID anymore. It's just pneumonia. I'm feeling better every day. You gotta believe me. I'll be home in a few weeks. And I'm very confident that I'll be home soon. And you can visit me.
I'm in California.
What's in California?
Me. Grad school.
You know I'm just joking. You know there's planes.
Aren't we still in a pandemic?
What are you studying that's so important that you can't come see your father? It's been what, 2 years?
You were the one who chose not to say goodbye.
I don't know how much of a choice I had. Your mother's on a fixed income.
I'd miss work for you.
Are we cool?
Sure.
Hey, today my oxygen was at 90. It needs to be 95 or higher, but I'm in good spirits. Oh, I took a shower today, almost by myself. Got out of bed and everything. The nurse was there to help me so I don't fall, but it was the thrill of my week. You know, I got to tell you, this whole thing has been really funny.
Really?
Your mother and I had a ritual when this thing first started. She would make a pot of tea, and we would sit and ask each other, who do you know personally that has the virus? At first, the answer was 0. That was just a year ago. Now you wouldn't believe it. All the hospitals in the city are to capacity. We were in the ICU like sardines. I'm lucky to be out of that room. I'm lucky to have my own room. I'm lucky to be going home.
Your cup runneth over. A friend of mine got it and passed. Recently. She was vaxxed, boosted, young, super precautious. It's not fair. Pretty unlucky.
That's really terrible. You know, there's so much that we don't know.
Are you serious? Are you trying to spin this?
No, I'm just saying, how do we reconcile cases like your friends?
Lily?
I'm sorry, cases like Lily.
I can't understand how you think a vaccine will do something worse than the virus you're trying to fight. Why don't you ask your nurse, or better yet, an epidemiologist?
Do you know any epidemiologists personally? I don't, but I know you. I know my resources.
And I know mine.
So now we're at an impasse. And this is where conversation breaks down. That's the problem with this country. You know what? I don't appreciate being laughed at. I don't care how many miles are between us. What you're not going to do is disrespect your father. Are we clear? Healthy skepticism about anything is good. They expect Black people to trust the same government that authorized the Tuskegee experiments. How do we know that there's not something more insidious going on? Hello? Ask the question. You know what? I'm not trying to argue.
Then what are you trying to do? You've clearly already made up your mind. There's nothing I can say to convince you, especially now that you've survived.
Were you expecting me to die? To prove a point? What kind of sick, twisted...
Didn't you give the virus to Mom to prove a point? That's what she said.
That was unintentional. And you know it.
But you weren't afraid. You were careless. Even with all her health issues, you didn't expect anything to happen.
I know you're upset.
Lily was a nurse. She had just left the field and decided to come back to help all the unvaccinated people crowding the hospitals. All the people, like you, who never say, "Let me go. I've made my choice." It's always, "Please save me. I don't want to die like this." That is before they're intubated and can't say anything at all. Since you're all about fairness, do you think that's fair? You make a lot of points about government-issued microchips, biomedical security states, Reagan and crack cocaine, Tuskegee. Too bad they're all straw men, and good thing Mom didn't listen. Do you resent her for that?
I'm happy she's not laying here with me.
She wouldn't be anyway. She'd be dead without the vaccine.
So what are you saying? You're perfect? That you've never ever made a mistake?
This is the first time you've called anything you've done a mistake.
Does that make you untouchable? Better than me?
I am better than you.
You take that back. I love you. Unconditionally.
You haven't said, I'm sorry, this whole call.
I'm sorry. I am. But that sort of thinking is dangerous. I'm human too. No one is better than anyone. You hear me? No one. Before things got as bad as they did, I walked around like my shit ain't stink. I thought and I did a lot of things that I'm very, very ashamed of now for good reasons, just like you and anybody else. No one would call themselves crazy. We believe what we believe because we believe it's true. But I'm learning and I'm growing. And you've got to believe I've changed me. This has changed me. Not just getting sick, this, you. Every day, people disagree. We can't survive as a species without it. I'm sorry. I'm sorry you hate me. Are you there? Hello? Can you hear me?
Get well soon, Dad. Good night.
The little lady will settle. You turn the music down. It just started, Stephanie. Who did this? When can I make it stop? I love this song. Again. Sure. Sure. Wow. That worked. Am I dying?
No. I'll dim the lights. Is there anything else you need before I go?
Code blue, code blue, code blue.
What is
Code
that?
blue, code blue, code blue.
What's that?
Code blue, code
Is everything
blue,
okay?
code blue.
Don't worry.
What was that?
They've got it. Don't worry. Is there anything else you need?
Can you take a break? I won't say anything. You can hide out in here.
I can't do that.
Well, then I need you to stay for 5 minutes to check my breathing. My chest feels a bit tight. I don't think I can go to bed unless I know I'm okay. I need you here, of course, to monitor my breathing. Can you close the door, please? I'm a really private person. Thank you. You know, you look exhausted.
I'll sleep when I'm home.
That's soon, I hope.
I work 80-hour weeks, but we're all spread thin.
I really appreciate everything you're doing. You've definitely gone above and beyond.
Your oxygen is 93, by the way.
That's great. Now, have a seat. You have 3 minutes to account for, and I don't want you to waste them.
It gets easier with time.
So who helps you?
We help each other when we can. Sometimes I sneak down to the maternity ward to watch deliveries from the hallway. The residents are often there too, and we cheer and smile and cry. It's very sweet and comforting. On the other side of this hospital, every day somebody new celebrates a birthday.
You're kidding. That's wonderful to think about.
When I let my mind wander, I find myself in this fantasy where I'm back in school, training to be a midwife. I'll do it, but they need me here for now.
You know, I cut the umbilical cord on my kid. That was the first and last time. My wife shit herself. I mean, literally, everywhere, blood and shit.
It's not for the faint of heart.
None of this is. I wish I could remember what my kid is studying. I'm sure it's not medicine.
Your kid doesn't hate you.
Whatever if they do.
You don't mean that.
Why don't I? Why shouldn't I? I too can be resistant to change. Watch me.
To what end? What song did you hear?
Bluegrass, just like home.
I hear classical music. Chopin, Tchaikovsky, Mozart. You know, it's in our heads.
The music?
Hmm? Everyone has it. It's just a matter of being attuned. Some people choose to ignore it when it happens to them, and some of us answer the call. Fewer choose to dedicate their lives. Teachers, social workers, doctors.
You kidding?
All of us here at the hospital, we hear music constantly. There's an old nurse's tale. Some doctor somewhere once said that a code blue is like conducting an orchestra. So we've been cursed with concertos ever since, or rock concerts, or raves. Depends on the person.
But it's not real, right?
Did it feel real to you? You were complaining, shouting.
I'm sorry.
Oh, why? Like I said, it's a gift. I think less people need to be sorry about this. That's what I think.
What is it anyway? Are we insane?
Does it matter? I'd rather be this than an iceberg. Cold, hard, and unfeeling. That would be insane to me. But maybe I'm on the moon. You aren't as resistant to change as you lead on.
You're scaring me. Actually, this whole thing is just so much to think about. I don't want to hear that I'm hearing things. You said everyone in the hospital? Is it like a virus? Can they do some type of research somewhere?
See? You're putting more faith in science.
But I'm not kidding.
Look, I don't think it's scientific. I think it's sociological or spiritual.
Oh my God.
All I know for sure is it's something like empathy, which is a byproduct of love. That's enough for me. We all have access to it at some time or another. I wish it didn't always start at stations.
What?
Hospitals. Here, I wish that it didn't always start here for a lot of people faced with their own mortality. Imagine if we continued singing lullabies to our children well into adulthood. Imagine if it weren't insane to be soft. Are you afraid of being soft?
Yes.
Well, you are.
Ouch. You know, you were going to be the last voice that I heard before I died.
You're not dying.
I'm just saying, this whole thing is so much to think about. You know, entering the next life.
All right.
But it's okay. And I'm grateful. Thank you.
Get some rest.
Oh, one last thing. Are you a poet?
I'm a nurse.
My kid is a poet. One time at an open mic in the before times, they said something. When we rest, we can heal. There's so many hurting people in this world, and none of them are sleeping.
When we rest, we can heal. It's biologically true.
You know, nurse, I hope you can rest soon.
Was that some kind of a backhanded compliment?
No. At least it wasn't meant to be. I don't know. There's no finish line. I'm realizing there's no finish line to healing or being a good person, or any of that crap. Well, not crap, but I used to think that things were black and white. That I crossed the finish line, that I was done. But if what you're saying about this music is true, if I'm just learning to be soft and insane for it at this advanced age, then it must not be the end. There's so much more work to do.
There is so much more work to do.
And that's great. You can be nihilistic and, you know, one of those poets, but I like your heart. I agree with it. Feeling like there's more time. And it's not too late. It's not too late for me. or anyone. And when I walk out of here, I'm going to hold that. And I'm going to do something about it. And I'm going to tell my pool buddies over a whiskey neat. And I'm going to visit my kid and hold my kid. Because I'm realizing now, I didn't. And
Get some rest.
you're right. Good night.
Sweet dreams.
Last night, I had a nightmare. You were a child, lost and scared, that I had to deliver to death's door. I looked down at our hands, and mine was as small as yours. There was no time to make sense of it, only time for I love you. My anger, my fear has always been love. I need you to know before you go that you are loved. And the notion staunched the bleeding as light filled the room. I awoke, crying, thinking, Dad, maybe it started there. When you were a child, you were born into a trauma response, learning to just survive before learning to walk. Maybe your dad didn't hold you either. Maybe it's become unclear who to blame. But does that matter? You are alive today and you will live tomorrow. So it is on you to change. You said our survival is dependent on change and dreaming. And I know healing isn't linear and cannot be done awake. Maybe all you needed was rest, safety, and rest. I see you now. Was this a test? All I know for sure, anger is a byproduct of fear, which is a byproduct of empathy, which is a byproduct of love. We will love again and again and again. All I know for sure, we need to face the music to save each other in the end.
Thank you so much, cast of A Soft Landing by Ange Bay. We are forever in your debt for telling this story. We are going to take a brief 5-minute intermission, and then we will come back with our second piece, Silos by Nikki, Brake-Sillá. Thank you so much. We'll see you in 5. Welcome back, everyone. We are going to jump right into our next piece. This next piece is called Silos by Nikki, Brake-Sillá.
I don't think I can do this anymore. I don't think I can continue to come in here, risking my life for people who refuse to believe that water is wet. How can I uphold my oath when at least once a day someone tells me that I'm the reason the Wuhan flu is here? Number one, there are a multitude of Asian countries. Number two, I'm Texan. Number three, it don't matter what I say. I'm not home at home. And whenever I visit family in Busan, they insist on speaking to me in English because it's easier for them to understand me. I didn't sign up for this. None of us signed up for this weight, this work, this lift, all this heavy lifting. I love my job. I'm great at my job. I've spent 8 years of my life becoming an important part of this team. I'm specialized. I wanted to work in the medical intensive care unit, this wing that has patients who are in dire straits, who need extra care and attention, people whose families leave them here in my care. So how can I look at them and tell them that I don't want to care for them anymore because they decided to not get vaccinated and now they're clogging up the system and once again putting my life at risk? Lord, please make it all make sense. I am weary and scared and so very, very, very sad.
Oh, come on. You've got to be kidding me. Okay. Hi. Yes, this is Mac Lewis from Contracts. What? Oh, yes, I'm fine. Well, no, I'm not fine. I'd be fine. Hell, I'd be fantastic if you could tell me if you have any warehouses that have in stock item BJ265100. Yes, it's a calculi strainer. Oh, you don't. Oh, because of the plastics shortage. Due to COVID-19. Okay. Thank you for checking. Yep. All right. What rabbits are you gonna pull out of your half-gallon today?
And here's good luck to the half-gallon, good luck to the barley mow.
Jolly good luck to the half-gallon, good luck to the barley mow.
Oh, you talking to yourself again, Mac?
I'm just trying to keep you on your toes. Hey, Think fast.
These fingers are like Velcro.
Yeah, can't say the same for your lips.
Oh, hearty har har. Admit it, you look forward to my visits. Who else would sing your drinking songs with you?
Yeah, or listen to my jokes. So, what's new?
Oh, same old, same old. Every day like the one before. Except some days.
I know. I know.
You know, I can honestly say I'm happy to be here. You know, seeing my hands working on making something concrete, you know, that'll be used all over the hospital.
Yeah, it's been a huge favor having you take time out of your day to help me. I mean, hell, you're helping the hospital too. But if you'd asked me before all of this started, if hunting and prepping and packing 6,000 supply kits a month would bring me joy, I'd say that is not my job, and you must have been off your gourd.
And yet, here we are.
Trading dad jokes.
You know, technically that's not true. You haven't told me today's joke.
Why is Pavlov's hair soft?
I'm gonna regret asking this, but why is Pavlov's hair soft?
because he conditioned it. I'm good. I'm fine.
You're fine.
Totally, completely fine.
But if you weren't, would you say something?
Do you feel like you're allowed to be tired? I mean, like this far in. I should be used to it by now, but you know, my kids' daycare, I swear, they have been open for 1 week, since the school started back in August. And on the days when one of us can't stay home, we have to hire a sitter or pretend to work from home.
Yeah, it's January, Mac.
Exactly. It is January, and we are almost on year 3, and it's not getting any easier. Do you know how long before you get interrupted by a 4-year-old?
How long?
3.5 minutes, give or take.
Sounds productive.
I'm getting squeezed on both sides, and I don't feel like I'm allowed to be tired anymore.
Who wants to hear us complain?
Yeah, well, we haven't lost our jobs.
We're insured.
We're alive.
We are.
You've got better things to do than listen to me and blabber on.
Nothing better than this. But, I should get these supplies over to Jeannie.
Oh, is that a thing?
What?
I'm just wondering if you take all the Mickey nurses their kids.
I'm helping out where I can. Anyway, thanks.
For
not going into comedy.
Rapid response team needed, 7 West. Rapid response team needed on 7 West.
Duty calls. I'll pick up the supplies on my way back.
Yeah, thank you for never making it feel like I'm complaining, and for making sure that I'm the better singer. Hi, yes, this is Mac Lewis calling from Contracts and Purchasing. I'm trying to track down some calculi strainers, and I wanted to know if you had any in stock. Sure. I'll hold.
Hey!
Hey! You always come through in a pinch. I really appreciate it.
Oh, we all have our part to play.
Yeah, but I mean, this is above and beyond. I guess that's a positive from all of this.
What?
Well, before we barely acknowledged each other in the hallway.
Well, I would say hello.
You did?
Yeah, you just never really gave us transport a second glance.
In my defense, it's life or death when y'all come on the scene.
1, 2, 3. So, if I didn't start making sure your unit got all the PPE available, you'd know my name?
Yes. No. Okay, fine. It gets crazy.
And before, we were all kept to our special areas of the sandbox.
Cordoned off.
Like silos.
And now?
Well, now it's all hands on deck.
Just make sure those hands are clean.
Always. Hey, Jeannie.
Yep.
I gotta tell you something.
Go ahead.
Well, I don't want it to change how you look at me.
What could you possibly say that would change that?
Are you sure?
Of course.
Okay. Well, you remember when you asked what's my favorite condiment?
Yeah. I told you mine was ketchup.
Yeah, you used to eat it by itself?
Some days I still do. You said you love ketchup. I told you how mayo makes me gag.
My favorite is mayonnaise. I know, but hear me out. It's flavorful, and I even make my own. The nurses at your station love it.
You bring it and share it with people? People I work with?
Yeah.
Oh, I'm gonna be sick.
Just try it. I make this basil aioli with aged Parmesan and freshly emulsified mayonnaise. The eggs are all organic, free range, yolks the color of the sun.
Just stop. I can't even look at you. You lied to me about your condiment choice? What else are you hiding? Are you some secret covert operative for an underground agency trying to bring everyone over to the white side?
Oh, calm down. It's not that big of a deal. I just told you because I didn't want you to be freaking out at dinner tonight.
Dinner would have been ruined. It's already taken us 3 tries to get here.
I know.
So glad I can breathe a little easier now that people are vaccinated.
My mom's not vaccinated.
As in, it's been 2 weeks since her second shot not vaccinated?
As in, she's not getting vaccinated.
You're kidding me.
It's not that easy convincing her. She's a different generation.
I have lupus.
I know.
So you know I can't be reckless when it comes to my health.
Look, she doesn't go anywhere without a mask, and frankly,
I
she
will
doesn't
not
really
be reckless with my health. It's bad enough with the work that I do.
So now what?
I don't know. I have to think about things.
Because I told you I love mayo.
Because you lied.
No, I didn't.
You know how stressed I was about getting COVID before I was vaccinated? The constant worry.
And now you're vaccinated. Listen, I get it.
No, you don't. You can just leave the supplies at the nurse's station. I'll put them away.
It's no issue for me to put them in the supply closet.
It's kind of slow here, and I need something to distract me.
Okay. I'm sorry.
Me too. Ah, damn it!
Hey, you good?
I got got into this thing with T and...
Oh, T from transport.
Yes, T from transport. Stop acting coy.
Well, you know what they say about assuming. Want to talk about it?
No.
Oh, have I ever told you me and David's origin story?
No.
Well, he was my intern.
Cradle robber?
Okay. I couldn't stand him in the beginning. Know-it-all, ass kisser. He was so clumsy. Would ask me out for drinks.
And you...
Don't drink. So I'm annoyed because he is always talking. And I start questioning why this person won't leave me alone. Then one day, it was a really bad day, David came up to me and hands me a handkerchief.
People still use those?
On it, there was a post-it. David had written, "If you let me, I can't make it any easier, but I can guarantee you won't have to shoulder it alone." And then he walked away.
Yeah. But now y'all have been married for 5 years and have the whole house, yard, fence, and ankle biters.
Okay, I'm gonna tell your nieces that you called them Pomeranians. And David waited for his moment. Don't blow yours.
I am so tired, oh.
Oh, Sylvia!
Yes, Mickey.
Well, all you need to do is add a new skill. I know just what you need. Add a new skill to your toolkit.
What's one more skill?
Well, I know just what you need. It's going to add the hope that we need in these unprecedented times of stress and change.
And are you sure I can learn and develop this new tool to help me day in and day out?
Of course, all you have to do is watch 20 videos that'll help you build your personal and professional resilience.
Just gotta get my mind right.
So you can act right.
Gratitude.
Exercise.
Mindfulness. Plank this.
How have we not burned it all down? COVID isn't killing us.
All this toxic positivity is doing me in. One more person says it's not a sprint.
God, and it turned out to be a marathon.
Well, guess what? I trained for a sprint.
And I can't run anymore due to an old soccer injury.
Did you sign up for the blood bank?
No, I'm 6 days post-COVID infection.
And according to the barrage of emails, you can still donate. Share those antibodies. Speaking of antibodies, was it hard for you to say you contracted your namesake?
You got jokes.
It's one of the few things that give me real pleasure. Whenever they call your name on the PA system. Paging Dr. Omarion to the MICU. Paging Dr. Omarion to the MICU. And to see all the people on the floor relax and chuckle to themselves, it's like we've got our own inside joke.
Okay, it's not funny. The one thing I can laugh at during these all-day meetings. All-day meetings on Blue Jeans, Zoom, Microsoft Teams, people still forgetting to mute and unmute. I went from being a physician to being an administrator who happens to see patients. I still have my normal workload. I wear all my usual hats plus the DEI.
Goody.
A fez would make more of a statement. Do you know how many years of education and training it took me to get here?
How many?
15 years. 15 years. And you know the phrase I say the most? I don't know.
Dr. Omarion, do you know if the monoclonal antibodies will be effective combating the new variant?
Oh, I don't know.
Do you know what the protocol should be for semi-private room if both patients have COVID but have different infection windows?
Yeah, I don't know.
How about the CDC guidelines that have gone from 10 days of isolation to 5 isolation and then 5 wearing a properly fitted mask? You're currently on day 6. Do you feel confident that your properly fitted PPE will help protect the patients and staff of this floor?
Oh, I don't know. I can't focus on that. I can't read those emails. I can't sit in the negative. It'll swallow me whole. It doesn't mean that I'm not sick to shit of it. And it doesn't mean that there aren't days where I question if this is really my calling.
Yeah.
But you know what? On those days, I hone in on the small things. The light in someone's eyes when they hear.
Paging Dr. Omarion to the ED.
On those days, I focus on the fire in the eyes.
Have a good night, Dr. Omarion.
Be easy.
The day is done, time has come. You battled hard, the war is won. You did your worst, you tried your best. Now it's time to rest. Now it's time to rest. Hey, T, you want to grab coffee tomorrow? You'd love to? Great. I'll pick you up.
Oh, fantastic job. Thank you so much to all of our incredible performers, our playwrights, our behind the scenes crew. This was so great. Thank you for helping us share these incredible stories. We would like to jump into some more of the health components of what you just witnessed. So I would love to invite Marian Leary, Director of Innovation at the University of Pennsylvania School of Nursing, to the Elevate virtual stage to host our panel discussion for this evening. Marian, welcome.
Hey, Christina, thank you.
Thank you.
Wow. Thanks to you. Thanks to the cast and crew of Elevate Theater Company for those two very moving performances. Performances that were based on conversations with Penn Medicine and Penn Nursing frontline healthcare workers, using their real experiences and emotions related to the pandemic and everything that's come with it. I'd like to wholeheartedly thank them for sharing their time and stories with us. And of course, I need to give a big thank you to SAC's Program for Arts Innovation for supporting this event. With that, I'd like to introduce our panelists who will talk with us about the themes brought up in these two plays. So when I mention your name, please come on stage, turn your video on, and we'll get started. First up, Horace Hubbard, a dispatch management team member at the Hospital University of Pennsylvania. Hope Atkins Durante, a staff nurse at Penn Medicine, Lancaster General Hospital. Dr. Zachary Mizell, Associate Professor of Emergency Medicine and the Director of the Center for Emergency Care Policy and Research at the Perelman School of Medicine. And our two playwrights, Nikki Brake-Sillá, who wrote Silos, and Ange Bay, who wrote A Soft Landing. Thank you all for being here tonight. Audience members, if you have any questions for our panelists, please feel free to put them in the chat or comment sections of your live streams. All righty, so let's jump in. Both plays focused on the real strain COVID has had on frontline health workers, both professionally and personally. One of the big themes of Silos is that it feels like everyone has to be fine. In real life, individually, it feels like everyone is admitting that they're tired and burned out. But organizationally, in all sectors, it feels like everyone's just going forward like nothing's happened. But a lot has happened. COVID, racial injustice, health inequity. How are you all feeling right now? Let's start with you, Zach.
So thank you. Great question, Marion. And I was just so moved by these plays. And it's an honor to be here and sort of sharing and riffing a little bit on my experiences and those of my colleagues in relation to these plays. I don't think there's anything special, frankly, about per se about how I'm feeling, or those of my close colleagues, as compared to so many other people who have, weathered all the upheaval related to the pandemic, specifically, and the world. But I will say that, and it's interesting that that one thing that we feel, or certainly that I feel, is having this sense of being maybe one step or two steps ahead of the rest of the kind of the world in terms of where we are. And so, right now we're sort of coming out of this little bit of a lull in terms of how people are feeling. The epidemic seems to have eased temporarily, and people have been sort of letting their guard down. And now we're just hearing and feeling a little bit of maybe some stress about it picking back up. And I would say this is one thing that I definitely notice and feel in working in the emergency department, this sort of worry about what's around the corner. And I think it seems to precede the rest of the world by a week or two. So that's kind of where I am.
And all right, I'll ask the same question of Horace. You and I had worked together for years at the Hospital University of Pennsylvania. And just like in that scene in Silos, when you showed up, I immediately had a smile on my face and my day was made better. How are you feeling right now in the work that you're doing? Is there still that sort of jovial atmosphere, or are things really so stressful that people can't even get to that place anymore?
Hello, Marion. Great question. So it's not the fact that it's a hard time to get back to where things used to be, quote unquote. It's just a sort of like, everyone getting back together, everyone trying to just figure out the new norm, pretty much. Still on a phase of trying to get back to being fully staffed. I feel like we're on the right path. People that still remain right now in healthcare is because I feel like it's because you have to love what you do every day, and you have to love no matter what the situation is. People that are still standing and still with the process and showing up every day and still trying to be that jovial person. It's showing that it's a true love for that profession, and just showing up every day to be for the next task to take on.
So I want to just play off of what you just said, because in Silos, one of the cast members said that it was making them rethink their profession. Has the pandemic and the ramifications of what's happened over the past couple of years made any of you rethink what you're doing or rethink your calling? And let's why don't we go with Hope first? And Hope, if you're talking, you might be on mute.
There, I think I have it. Absolutely not. So when the pandemic first started, I remember, when the breakout was in New York City, my first gut instinct was to run to New York. Like that's what I wanted to do. Um, Obviously that was not okay with my family for me to go do that. But it absolutely did not change what I do. If anything, it made it more pertinent. Um, you know, I chose this because, I'm here to serve. And at that time and at that height of the pandemic, the only thing I had was to give of myself. So I wanted more than anything to run right into the fire. And I think a lot of nurses understand that feeling. If you're there for the right reason, if you're there for it, it didn't, unfortunately, work out the way we always wanted. With even just coming home and telling stories to my family, and they just didn't understand like what I was facing every day. And, I had to accept that they couldn't understand me seeing a patient die. They didn't understand that phone call I had to make to the daughter who, to tell her that her mother had passed away, that she couldn't see, so it was a difficult time because I felt like, I wasn't always understood at home, but at work with those ladies and gentlemen that I worked with on the front line, it was a bond. It was like an instant. It was almost like going to war, even though I've never been to that. I can't, you can't explain it to somebody until you've been there yourself. But we had a camaraderie that was, it changed us. It made us tighter. It made us work better together. And it's not something I would ever take back.
Zach or Horace, what about you? Has it made you rethink the work you're doing today?
It didn't make me rethink. So you go through things and then you may want to say like, hey, I wonder if over here is better than where I am now, or if any other organization is dealing with it the same way, or oh, how come we don't have that many supplies? Or so then you just, it makes you take things as they come, and the less you compare, the happier you are. And it just is, and that is not only true at work, it's true in your personal life as well. So you just kind of have to show up every day and take it as it comes. And I agree what Hope said is to it really helped different people and different departments all come together and work as a bond to just conquer what was in front of us.
Yeah, I would say the same. I think particularly at the beginning, when the sense of camaraderie and the focus on just showing up to take care of people who were really in desperate situations was really overwhelming and very reaffirming. I think from a career perspective, I think the pieces that certainly I felt, and that I think some other colleagues have felt as it relates to some of the challenges and frustrations of a healthcare system and a society that is in so many ways has pieces of it that don't work well enough, and particularly for the most vulnerable members of our community, has been very, very frustrating. And thinking about that is both a motivator to try to think about ways to fix it. But when you bump into challenges that are sort of outside the control of your immediate environment, it becomes hard. And that can, I think, lead to, certainly for me, sense of feeling demoralized. But the value of working as a team to save people's lives who are suffering is really, at the end of the day, the core of what we do. And I think it's affirming in ways that in some ways our colleagues who don't work in healthcare haven't had. So it's both a little bit of a blessing and a curse.
So I want to bring in our playwrights. Thank you to Nikki and Ange for beautifully crafting what you heard from our frontline workers during those workshops. I guess I want to start out asking, how did you pick the themes for each of these plays? And what about what you heard in those workshops helped you to focus on the themes that you ultimately based your plays around? And Nikki, do you want to go first?
Hi, thank you all. I really appreciate it. So I have a little confession to make. I have an inside track. I'm a project manager in the School of Medicine, and I have been that for, I don't know, almost 10 years, and I've been doing research for 20 plus years. So I initially, when I was approached with the project, in my head, I was like, oh, does anyone really want to hear a COVID play? Like, that's kind of sad times. So I wrote a piece from the workshop that was beautifully orchestrated by Christina and Dee that focused on the joy and just kind of like the everyday and what you have to use to in order to get through it and in order to persevere. And I took those stories and just wrote, I was like, what have I heard from my friends that are physicians, that are nurses, that are NPs, and what are the common things that they're talking about, and what are the fears that they have, and what keeps them going back every single day when they're, at the beginning of the pandemic, there was no PPE and people were getting COVID right and left, and people were having to quarantine in the hospitals and not being able to see their families. And so what was it that was making them still come back 2+ years later without being bitter? And so those are the stories and the themes that I latched on. And especially I'm really interested in people of color because we had a completely different experience during the beginning of COVID. And so it was really important to me that the two characters, like everyone else, it could be whatever gender or race, but it was important to me that the nurse be Asian American. And it was important to me that Dr. Omarion be someone who's Black. So those were the two things that, because I think that the nuance in what was also happening and being said to them was different than what everyone else in the hospital might have been perceiving. And I wanted people to come away with some hope.
Thank you. And Ange?
Yeah, what a great question. Yeah, I was so inspired in my workshop, beautifully led by Marisol as well. So she's doing triple duty in this project. Was really, really inspired and taken with thematically what was being said. So this idea of hospitals being sort of like dichotomous in their purpose. There are people that are being brought into the world, then there are people that are exiting the world in hospitals, and how nurses, doctors, and all the medical staff have to be shepherds of both of those things. I was also taken by the unifying experience of all the participants of like feeling so tired and so spent by the long hours and the long days of, trying to save people's lives. Ultimately, that's what everyone is trying to do at a hospital. And also the hope, literally hope being in the workshop. You actually inspired much of what the nurse ends up saying and much of the metaphorical things that have happened, but the idea of hope and why medical healthcare workers choose to come in to do their jobs every day really, really was something that I thought was beautiful and resilient. And then I was also thinking a lot about a couple of the stories that were shared about how to sort of like justify being in the room with someone who was like chosen to not be vaccinated.
And it was really important to me to humanize everyone in those situations. And I think that, people believe what they believe because they think it's right and they think it's true. And that, that sort of idea affects all of us, no matter what your ideology is. And so leaving the characters open, nurse, astronaut being the same, and child and dad, any gender, any race could play those roles, and really wanted to universalize that, those very human characters and motivations, and especially setting it in a hospital during the pandemic, having a full perspective of everyone in the room. I think was really, really important to me.
I have so many questions I want to keep asking all of you. I think I'm going to switch back to our healthcare frontline workers for a minute, and let's talk about vaccines. Obviously, vaccines have made a huge difference in this pandemic. In both plays, there's a tension around individual rights related to vaccines. And of course, the patient in A Soft Landing is unvaccinated and states that a healthy skepticism is good. As healthcare workers, do you think a healthy skepticism around vaccines is a good thing? And I'm going to start with you first, Zach, if that's all right.
Well, I actually really liked the healthy skepticism part of that dialogue, because it humanized that conversation. And there's I think there was some nuance there that you could feel, and that's the truth about sort of skepticism, right? It's not the truth about vaccines. Vaccines, there's no nuance there. The vaccines, at least as a public health enterprise, are some of the most effective things that we can do, that have saved more lives than at pretty much any other piece of public health ever. And COVID vaccines have borne that out. But being skeptical about about data and about science, particularly when it's coming, or not necessarily about science, but about new scientific information, particularly when it's coming fast and furious, is important. And you can see how it can be some of that nuance can lead to confusion and ultimately lead people to make the wrong decisions. So I don't think there's any moral weight that needs to be attached to this idea about being skeptical around something like vaccines, particularly, as the character said, when science in the past has sometimes atrocities have been performed in the name of science. That said, there are, I guess, I think that at the end of the day, we have to, come down, plunk your nickel down, and we now know that obviously that vaccines have done so much to actually mitigate the impact of COVID that it's no longer up for question, and we have to go with that.
Hope, I'll ask you. Did it feel like there was any sort of resentment or uneasiness about patients who were unvaccinated coming in and quote unquote taking up bed space for people who were vaccinated? Was that a real thing?
So I can talk personally. My husband chose not to get vaccinated. So for me, it's been trying, and it was difficult. And I think, but there again, I believe in everybody's right to choose, their lifestyle, or choose, their wishes. I believe everybody this is their experience, this is their journey, this is their healthcare. And ultimately, they have that right to choose. But, my mother also has breast cancer. So it was difficult, I think, when I saw all these people coming in, and I knew that people were getting turned away from having chemotherapy because we didn't have beds. So it was difficult. It's like, how do I advocate for both? It's like, I want to understand and appreciate and value your, I'm sorry, my cat is crazy, and value your right to choose. But I also, in my gut, am thinking there are people out there that don't get a choice, and they're going to die because you didn't make a different choice. So it's been difficult. I don't know that there's any right or wrong answer. With COVID, we kind of were building the plane as we flew it. So I think, 10 years from now, we're going to have all this information and we're going to have a better understanding of everything that's happening now. Did I change my care? No. So I'm going to treat you the same way I'm going to treat somebody that is vaccinated. I'm going to give you the same care. I'm going to give you the same attention. So my role as your nurse is not to judge you, is not to put you down. I can only educate you. And if, you have the education that's correct, and that's the choice you make, then I'm going to be here regardless. So personally and professionally are two different things, I think. But yeah, I'm going to show up for you regardless. But yeah, that was difficult.
Horace, what about you? Any tensions related to the work that you were doing?
Not in that direct effect, but definitely seeing, so every day being in healthcare, we go into uncertain situations every day, and we know that the job must continue to go on. So with the vaccination and people being, not vaccinated, I had to ask myself, hearing, all the news reports and everyone chattering, family discussions and colleagues and employees, so I had to ask myself, do you, normally you go to a doctor and your doctor visit, and they have to give you your annual flu shot, they give your tetanus shot or whatever the case may be. And I asked myself, so they are giving me a shot every year, and I have no idea what's in this shot. And I've never once questioned that doctor, my primary care physician or whoever, well, what is in that shot? What are the exact doses are in that shot? So I'm thinking, okay, now we have a vaccination that could potentially save my life, and just, protect me from my family. I have a 5-year-old daughter and, an elderly grandmother. So I just had to put everything in perspective for me first to make it make sense. And I'm always a hesitant person anyway when it comes to vaccinations, needles. But so once it made sense to me versus me, having a realization with myself first and saying, hey, I have never ever questioned a doctor, what's in the flu shot, what's in the tetanus shot. I've never heard that before, it's easy to get overwhelmed with all the, all the, updates on at the time, the vaccinations and the guidelines and what you need to do and what's not safe. But it was a lot of uncertainty. But I know every day we go into uncertain situations at work anyway, and you just have to make it work, and you have a choice to make. You choose not to, and that's what you deal with, or if you choose to, that's what you deal with. So it made me, just have a realization with myself first to, come to the grips of, being vaccinated or not vaccinated.
So we have 5 more minutes left of our panel discussion, and really I could talk with you all into the night, but I want to be respectful of everybody's time. So we have some questions in the chat that I'd like to transition to, one of which is regarding the resilience and gratitude part of silos, which the person who commented really enjoyed that part. What do you think will help staff to address wellness and balance moving forward? Hope, why don't Nikki, go ahead. No, go, please, 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 please.
Oh, for me, it's for people to stop telling me to be resilient and mindful. Every single day, I get 5 emails with 5 different ways to be resilient, and you haven't forgotten about COVID, or COVID hasn't forgotten about you, and we haven't forgotten about you. I know you haven't forgotten about me. I just need some space. So that's for me. Stop telling me what to do.
Hope, do you want to chime in?
So for me, my resilience doesn't have to come from, an email or group setting or a high five. It's when that patient says to me, "Hey, are you here tomorrow? Hey, you changed my hospital stay for the better. Hey, what's your name again? I want to write it down." So for me, that's all I need. So my cup gets full by hearing back from my patients that they want to see me again, that they appreciated my care. And even the patients that don't appreciate my care, I appreciated them, because I think it's a great honor to be a nurse. I think it's an amazing thing we get to do. We get to be with people at their most vulnerable points in their whole life. So for me, I try to look at the positive things, and ultimately they always outweigh the negative. And if the negative ever outweighs the positive, then it's time for me to step back. But until then, I'm good.
And do you think art can help with wellness and resilience?
Yeah, I mean, personally, it has for me. Art therapy is a whole nother sector that I'm really interested in, and that I actually have someone close to me studying right now. And just hearing what she has to say about what she's learning in grad school has been really, really, it buoys me as a theater maker, as an artist. It's sort of my personal mission statement to continue to make art, especially as a playwright, that hopefully opens up a conversation for healing. And personally, I love doing this kind of work where I get to write directly from people's experiences, and whether that's community created work or like this project, talking very specifically to a community as well. The short answer is yes.
Nikki, any other thoughts on that? How art can heal?
I think it's, for me, I write plays so that people learn something, either about the subject matter or about themselves. So that's how I feel the change happens, is when it's changed a little bit of yourself. You're a different person from the beginning than you are at the end. And so it's the ripple effect.
All right. So our final question that came in, or the final question I have time to ask, there are many other questions. How do you think COVID will inspire or dissuade the next generation of frontline healthcare workers? Zach, do you want to take this one first?
Yeah, I think that remains to be seen. I was really hoping that there would be a sort of a mass desire to jump in from people who are early stages of their life or career. And I think I've been hearing some trickles about people who weren't interested in health or healthcare or public health, and now they are. So that's really exciting. I will tell you, just to add a dose of skepticism and worry to this question, the number of medical students who chose to go into emergency medicine, which has always been a very competitive and highly desired field, dropped precipitously this past year. So if that's any indication, then we might be in a little bit of trouble. And we have to do more, I think, to continue to do things like this, which is to share, I think, the stories of resilience, not just of burden as it relates to being on the front lines. And so I'm very appreciative of this forum.
Any final thoughts from any of our panelists before we close out? Or you looked like you were going to say something.
Well, just to piggyback off what Zach said, I feel like with the next generation coming up, or that's interested in healthcare or emergency medicine, that it could be made known that there is a balance, and it should be taught that there is a balance between like your profession and your personal life, and it being all tied together, that you can't find a balance. You have to create your own balance when it comes to being in that profession, and that is really most important, is to let them getting as much information out as possible to steer them in the right direction, thinking about balance. Is some people think this is just a very demanding field. I mean, of course, it all depends on what avenue you take in the medical field or what you're going to study, but that keyword should be balance, to normalize and just kind of bring it all together for the up and coming generation that is interested in this healthcare.
Well, with that, I want to thank all of our panelists again for sharing their time and their experiences with us. I'm going to ask Christina to come back on stage, and we'll close out the Frontline Health Workers Digital Theater event.
Oh, Marion, what an awesome, awesome opportunity we've had tonight to see these shows, to share with our playwrights and our panelists. Thank you. Did you have some final closing thoughts you wanted to share?
So just some final closing thank yous. I want to thank you again, of course, Christina, and all of the cast, crew, panelists who helped make this event, as you said, a healing event tonight. I want to thank all the Penn Nursing and Penn Medicine frontline health workers who so kindly shared their stories with us at the workshops that helped inform these plays. And again, to all the frontline health workers and all the frontline workers around the world who really did help keep the world running in the midst of a global pandemic and so much more. Thank you for all that you did for everyone. With that, I'll just say, unless Christina has any final thoughts.
My only final thought is that a ditto on all of those thank yous. And I also want to profusely thank the artists that had a hand in tonight's event, the behind the scenes folks who had a hand in tonight's event, and everyone who was part of this community. We are so, so, so grateful. Definitely check out the Elevate website, and we have some upcoming pieces. If you like this juxtaposition of health and theater, please definitely keep in touch. But thank you again. Be well and elevate.